Lots of us are planning to eat healthier food in the new year, but the definition of what that means just changed. The Food and Drug Administration has just released new guidelines on what counts as healthy food to help people make better choices while grocery shopping. Popular items like yogurts with too many added sugars, fortified white bread, they no longer make the cut. These changes are the first updates to the agency's standards on what qualifies as healthy. First update since 1994. Joining us now for more on this is Dr. Omer Awan. He's a physician, professor at the University of Maryland School of Medicine, and a senior public health contributor for Forbes. Doctor, good morning. Walk us through these guidelines and what the FDA now is saying defines as healthy.
Well, there's two major changes, Christine, with respect to the FDA. Now the FDA is going to consider added sugars, the amount of added sugars in foods before putting the designation of healthy. And this is important because nearly 2/3 of Americans take in more added sugars than what the FDA recommends. And added sugars has been helping fuel this obesity epidemic, the surge in type 2 diabetes, which is obviously a chronic condition where people have high blood sugar levels. And the second major change is that there's more of an emphasis on food groups. And what I mean by that is that before, if a certain food had a certain amount of individual nutrient like vitamin A, vitamin C, or iron, for example, it would be considered healthy. But now there's more of an emphasis on foods being part of food groups, so things like fruits, vegetables, whole grains, proteins. And that's also important because 3/4 of Americans actually don't take enough fruits, vegetables, or whole grains in their diet. So those are the two major changes compared to the ruling in 1994.
As we mentioned, this is going to be the first time the agency has considered updating those rules in 30 years, right? This follows a report released earlier this month on dietary guidelines. It showed 73% of adults in the U.S. 20 years or older are overweight or obese. So what are officials hoping to signal with these new rules?
Well, I think it's huge, and it just emphasizes the fact that so much food and diet has a profound effect on our health. And when we consider things like obesity, type 2 diabetes, heart disease, I mean, the common denominator for these are, diet and poor diet. And if we change our diet, and if we change the way we eat, we can reverse and even prevent these diseases. And think about how the billions of dollars that the U.S. federal government can save if we have decreased rates of heart disease, if we have decreased rates of diabetes, if we have decreased rates of obesity. I mean, this is becoming a major problem when now 3 in 4 Americans are either overweight or obese. So hopefully this can change the tide with some of these, major chronic diseases.
And Doctor, we've been showing these amazing pictures of beautiful, obviously very, very healthy meals, but it's the processed stuff that sometimes it's hard for consumers to understand. And the FDA is also working on healthy labeling for companies to add to packaging. What can you tell us about that? Will that help?
I think it will. I think it's a positive move because, what's going to happen if you have positive symbol, then it alerts people that it's healthy, right? So when we go to the grocery store, we want to know what's healthy. Often families want to know what's healthy and what's not healthy. So it makes it easier and readily more available to find and to identify foods that are more healthy. And I think it also promotes nutritional support, nutritional awareness, being mindful about what's healthy and what's not healthy. And often before we change our behaviors with food and diet, we have to think about the things that are healthy and that are not healthy. And, this graphic can certainly help with that.
All right, Dr. Omer Awan, thank you so much.